Hello, good health seekers. Today's video, I want to talk about how your bleeding gums can affect your white blood cells immune system. That is leukocyte. Sometimes when we go to doctors for blood checkup, then we find out that the results of the white blood cells are very low or very high. Sometimes it is due to our bleeding gums, or maybe we have some tongue, maybe through brushing of teeth we have a bleeding gums, and as a result of that the results can be of a negative side. First and foremost, I want to talk about what is exactly white blood cells, leukocyte, or immune system. Immune system is an inbuilt in our system. We all are be born with it because they are, that is what God gave us. It's just a first aid. Anyway, first and foremost, let me explain what first aid is. First aid is the first treatment given to any casualties before the arrival of a doctor, and that is the work of the white blood cells in our body. White blood cells are of 5 categories. Number 1, neutrophils. Then we have lymphocytes, monocytes. We have eosinophils and basophils. There are 5 of different kinds, and they all work together. Let me just put it in an easy way, that a very easy way that everybody will understand. For instance, if there is a fire or there is a war, fire brigade immediately the siren is on, all the fire brigade workers will start running to their vehicles to go to the scene where there is fire. And all these 5 white blood cells, that is the kind of job they do. They help us to fight any bacteria in the body. Neutrophil is around 70%, 50 to 70% in our blood, is the highest, while lymphocyte, monocyte is around, together the two of them should be around 26%, while basophil is around 1%, and eosinophil should be around 1 to 3%. So let me quickly explain how it affects, how it works. When you have bleeding gums, it's like there is a fire somewhere, like a fire brigade. When you have a bleeding gum, the neutrophils, all the white blood cells will be alerted, and they will move direct to the spot where there is a scene of the fire to see how to handle it. So on that process, neutrophil will start producing more of the neutrophils, and when they get there, neutrophil especially is a kind of, when they are going to the scene to go and make a rescue or to fight the bacteria, if there is any way or around there he finds sugar, he will go straight to the sugar and forget fighting the bacteria. So their main work there is to see how to fight the bacteria, and on this process the neutrophil or the white blood cell will start increasing. And if your gums, you have a bleeding gums, maybe you eat or whatever, the bacteria can go from that very particular point into the bloodstream. And when it gets into the bloodstream, on that process, maybe you go to doctor for a blood check, you might find out that your white blood cells are too low or they are too high, which might result your doctor sending you to where they will, to other specialists, where they will go to check your bone marrow if your bone marrow is producing enough white blood cell, because the bone marrow is where the white blood cells are being produced. So concerning the bleeding gums, it can make you to get a negative answer. So this is just the summary of this, how the bleeding gums can affect your white blood cell, your immune system, or you can as well call it leukocyte. I will still have more videos. This is just a summary. I will still have a part 2 of it. That is when I will finalize more details about it. Thank you.